it's like a ship without a rudder. If you don't know where you're going, you're just going to aimlessly go through the water and never end up at a destination. So my my advice for nurses, whether you're new to the emergency department or anywhere, set a career goal early. Know what you want, what's success, where do you want to be at 55, and then have mentors that'll help guide you there, that'll tell you whether your career moves are good or bad. And that's really the only way you're going to feel, I think, successful in a career.
Hello, and welcome to the Art of Emergency Nursing podcast. This is where we share stories for inspiration, entertainment, and encouragement, because we all know emergency nurses have the best stories. Now here's your host, Kevin McFarland.
Hey everybody, welcome back to the Art of Emergency Nursing. I'm your host, Kevin McFarland, and thanks for listening to the podcast. We really appreciate you being here. If you haven't done so already, please go to iTunes or go to your podcast player of choice, hit subscribe, make sure you don't miss any episodes, and then get on there and leave us a rating and review. I have a special treat for you today. I have an interview with one of my nursing mentors, someone I look up to both personally and professionally. He was fresh off the ENA presidency when I got a chance to sit down with him, and he happened to be in town, so I got to do my very first in-person interview. The sound quality is not great, but the content quality is fantastic. You are going to enjoy this podcast with the former ENA president, an educator, a flight nurse, and a nurse that you all know, Jeff Solheim. Go ahead and start by just introducing yourself. Tell the audience who you are and what you do.
All right, so I'm Jeff Solheim, and I hail from the West Coast. I guess I will call Portland, Oregon my home, although I spend a lot of my time in Hawaii as well, so I split my time between the two. And I am a registered nurse. I have been a registered nurse. I finished nursing school in 1989, and I became registered in 1990. So I've been at it for a few years. I started actually in otorhinolaryngology, which I think gave me a really unique perspective in nursing because I got to start in such a specialty unit and thoroughly loved it. I probably could have spent my career up there, but unfortunately those were not good times for nurses, and we got laid off, and I got my pink slip and moved down to the emergency department, and that's really the end of my story. I've been an emergency nurse in one way, shape, or form my entire life, whether that's working as a staff nurse, manager, director, educator, trauma coordinator, and now currently a flight nurse.
Nice. So you do flight nurse in addition to teaching, or is it more of is the flight nurse more full-time? Or?
Interestingly enough, I've been doing flight nursing since the mid-'90s. I got a job in the mid-'90s, and at the time I was an ER director, and I really wanted to hold on to that clinical side, and so I found a job that allowed me to work weekends as a flight nurse, and so I picked it up and would work one weekend a month, and I still do it to this day. Interestingly enough, it is almost 20 years later. Actually, it's a little bit more than 20 years, and I still do one weekend a month.
Nice.
72-hour shifts, so I work 72 hours a month, and at one time it allowed me to keep up my clinical skills. Now it really just is my passion. Yeah,
it's a lot of fun one of the things I found is, I'm doing more kind of leadership now, and I find that my part-time job, I picked up a part-time job at a pediatric emergency department, and I love just being able to go and just take care of patients and just go be a nurse.
Mm-hmm. Absolutely.
So it's nice to do that for a change instead of worry about, who's doing what and, being the leader and keeping track of everybody. Just go take care of patients, and, it brings me back to the passion of why I do what I do. So.
Absolutely. I think, being clinical, yeah, you're right. It meets a need of what we went into, and I also think it gives us validity in the field, which is important.
Absolutely. You keep your hands in it. Otherwise, you're not sure. Like for an educator, I know you're an educator, and you have to keep current because everything's changed.
Absolutely.
Everything changes so fast. So
we were just talking about this the other month. When you work 72 hours a month, but for me, that's one shift. So it seems like almost every month I literally have to go in and do an in-service because of some new equipment, cartridge, whatever that's come out since the last time I worked. And I work once a month, but to think of how dizzying the pace of nursing and medicine is these days, where almost monthly you're having to update yourself on new equipment so you can go in and do a shift. Pretty incredible.
It's just crazy. Just crazy.
And when we were talking about this, we were looking back in the 1990s when I started nursing, and I can remember back then, probably from 90 to 95, the biggest movement we made forward in nursing was we went from mercury thermometers to electric thermometers, and that happened in a 5-year period. Now every month I'm having to learn a new skill or a new cartridge or a new something
Yeah.
because of how dizzying the pace of technology is today.
Yeah. Do you think a lot of that has to do with just the amount of information that's out there with the internet and with the vast, like everything turns on a dime. Textbooks are almost outdated as soon as they come out.
Yeah, absolutely. I think nursing is no different than the world. You think
Yeah.
of the dizzying pace that the world moves at from a technology standpoint. I mean, who would have thought 20 years ago that I could hold a phone in my hand that would give me the access to basically any information I want to put my hands on? That was unthinkable 20 years ago. Um, so, it's not just medicine that moves at this pace, it's the world, but medicine has to keep up.
Absolutely. Absolutely true. So, what made you decide to get into nursing?
Um, I think multiple things. I suppose, like many of us, I had some family influences. It was something my mother always wanted to do, so she often talked about it. So I suppose that piqued my interest. I grew up in a fairly conservative home. My father was a pastor in a fairly conservative church, so I was often exposed to missionaries and that would come to our church, and I always wanted to um, be a mission, go over in the mission field and like do medicine over there. So I think between my mom and kind of growing up and seeing these things, I had a taste for it. And then at 15, I was diagnosed with lymphatic cancer. So I ended up spending a year in healthcare, and I think that kind of took that interest that I had piqued and just it threw me in the middle of it, and I just developed this great interest in it. So all kinds of things came together to draw me into nursing.
Nice. At what point in your career were you just absolutely sure you made the right choice?
Um, I don't know that there's any time I have ever regretted nursing. Um, in nursing school, I doubted it. I actually went for 1 year of nursing school and quit,
Wow.
and went into medicine. And I did my pre med and realized quickly that that wasn't for me. So that maybe was the only time I've ever regretted nursing enough to actually leave it and then to go back to it. But I mean, I graduated and I went, as I said, right into that otolaryngology job, which I loved. And then, the emergency department, which is even a greater love. And then my career has just moved at such a dizzying pace, from staff nurse to manager to director to educator. And it seems like every couple of years I got a new opportunity. So I've never tired of what I'm doing. I've always been challenged, and I can't really remember a time I regret it.
Yeah. If your world was completely changed and your nursing license was gone tomorrow, what would you do?
Perhaps at this point in my life, I would travel for a living. um, but if I go back a few years ago when I'm not in the place I am now, um, if I didn't have nursing, politics is something I've always been interested in. I actually dabbled in politics a little bit when I was younger, and I thoroughly enjoyed it. So yeah, politics. Running for office somewhere, either at the um, county, state, or federal level would be something I'd be interested in. I'm not even going to say I've taken it off the table as a future for me now. Um, it is one thing I'd definitely be interested in. And I do. I absolutely love travel. I'm enthralled with it. So I could see myself trying to get a job with the United Nations or the State Department or even some organization, non-political, that would allow me to be overseas, because that's just really where one of my passions lies.
That's cool. That's cool. Tell me about a patient that changed the way you practice.
Tell you about a patient that changed the way I practiced. Whew. I'm going to. I'm not even going to use a patient. I'm gonna make it a little bit more broad. But when I was a younger nurse, I had the opportunity to work down in South Texas in the Rio Grande Valley, and I had really had no exposure to trauma down there. And then all of a sudden, I moved to this hospital that really just all they did was trauma. I mean, we had great penetrating trauma, whether that be gunshots and stabbings, and then just incredible motor vehicle collisions, and that opened my eyes to trauma. I fell in love with it. So I don't know that there's one patient, but it was that 3 year experience of just being exposed to some of the most incredible trauma in this little tiny ER that really shaped my love for the trauma side of nursing, and I've never lost it. I mean, if you look at most of the things I write, uh, most of my teaching, it always revolves around trauma. So I don't know that it was one patient. I can certainly tell you all kinds of just almost hard to imagine stories of the traumas we carried down, but it was more the conglomeration of experiences, and caring for, 50, 60 traumas a day that shaped
It's
who I am
crazy.
today.
It's crazy how busy those small little hospitals
Yeah,
can be. And
13-bed emergency department.
holy cow.
Yeah, 13-bed emergency department, and we could put through in a night 6, 7, 8 penetratings, on a night
Wow.
shift. Yeah.
It's always amazing when you see. And I had the opportunity when I was a trauma coordinator. I had the opportunity to go to these little hospitals and do their trauma surveys, and to see these little hospitals and then to see the kind of trauma that they do. It's incredible. You're like, who would have thought that they do that kind of trauma? But they do. They do it every day. And it's just what they do. So
And I think what makes a difference in a small hospital, like you might talk about, is not just you doing sometimes crazy volumes of trauma, but you do it without the resources.
yep.
I mean, I can remember when you get a motor vehicle collision with 6 or 7 people in the car, there was 4 registered nurses on shift and a doctor, and then you'd get the trauma surgeon in. So there would be one person per room running a major trauma. I mean, I can remember several times where I was in a room with some pretty crazy traumas, doing it by myself, waiting for a trauma surgeon to show up. You know, the one story I remember was a fellow drove his semi truck through a house. He literally missed a corner out in the rural area. His semi truck went through a house. Fortunately, didn't injure anyone in the home, but he scalped himself. Um, and so they brought this fellow in with bandages on, and so there was a student nurse in the department that night, and so I had the student in helping me. So I'm taking care of this guy, major head injury, significant internal trauma, and so it came time to see what was under the bandage. Now they had told me he was scalped on the in report, so I knew kind of what to expect. But I'm undoing the bandage to kind of see the extent of the injuries under his head, and as I unwrapped the bandage on his head, his scalp started falling off because it wasn't
Oh
too
my gosh.
attached. So I'm trying to hold the scalp on and trying to reach another bandage, and I can't because I'm in the room, well, almost alone except the student. So I started to ask the student to get some more bandages for me before the scalp fell on the floor. Where's the student? Oh, the student's on the floor, passed out cold.
Oh my gosh. You're like, wait, hold on.
Yeah, so okay, well, guess what, guys? I'm really alone now. I thought there was 2 of me to do this, but it's going to be me against the world for a while. And now I have 2 patients instead of 1.
You're like, here, patient, hold this right here. Hold that right there on your top. There you go. Holy cow. What did the students say when they came to? I'm sure they were just mortified.
Absolutely mortified and really wanted no part of the emergency department ever again. I think I completely ruined that career.
I always laugh, when we see these nursing students come through and you think to yourself, this is going to shape your career. You're either going to love this or you're going to hate this. And there's very few that are in between, but it's either you'll find out that either the ER is for you or you just think this place is nuts. And you're like, no way. So
Maybe I'm not proud of this, but I think there's one other young man I drove out of nursing unintentionally and in the third world. So I spent a lot of my career working in the developing world, and I had this young student with me. He was not even a year out of school from Hawaii who went with us, and we just had the worst patients. I remember I had taught him how to clean out an ear, and he tried to do one on his own and ended up being full of worms. And I mean, I can just go on about these horrible stories we don't need to do, but I know in the end he was kind of disengaged, and I later learned he left nursing, and I probably have to take blame for that. not my intention, but
Certainly
I guess
not
it
your
just wasn't for him.
yeah, it's one of those things that I think I certainly think there's something that puts us where we need to be, and even if that is maybe to give us a gentle nudge somewhere else.
Sometimes, yes.
Sometimes that's what you end up getting. Tell me about your first medication error or your first patient care error.
Ironically, my first, at least major medication error that I can remember, wasn't my fault. It was a mistake that the pharmacy made. Now, I mean, we got to go. We're talking now back in the '90s when we didn't have Pyxis and all that, so it was still the crazy days where you'd go up into a med cupboard, and I was working in otolaryngology at the time, so I had a whole bunch of patients, and you would literally take med cups and pour everybody's meds in cups, put their room number on the outside, and then go up and down the hall and hand out these meds. And I had a dermatology patient. who was pretty sick. He had Stephen Johnson, so he didn't have a lot of skin. And I poured the meds. Fortunately, I didn't make the mistake. The pharmacy had put the wrong pill in the bottle. So when I pulled it out of the med thing, I just poured. I double checked. I did my things. I was given the right med. I poured it in. I do remember I had a student at the time. I was precepting a third-year nursing student. And we gave the patient the med, and not more than 30, 40 minutes later, the pharmacy called in a panic, realizing that they had put a diuretic into the bottle instead of, I don't even know what the medication is I should have been giving him, but this guy had Stephen Johnson, so he did not need a diuretic, and he was already fluid depleted, and he started diuresing really bad. Now, fortunately, he was good-humored about it. I went and told him about the med error. We ended up giving IV fluids. We were able to resuscitate him fine, and there was no bad outcomes, but it was scary. Whether you're at fault or not.
Absolutely.
There's a sense of responsibility. So, who knows? I could have made med errors before that, but that was the first significant one I remember.
They're always scary, but the first one's always like, you're like, oh, how did that happen? And sometimes they're just completely unavoidable. But
I can't believe there weren't more. Like I said, there could have been, but I remember handing out meds to 36 patients on a surgical unit at night, because it was. There was me as the charge nurse, and a new grad, not even written my NCLEX yet, and I'm in charge of the unit with 2 LPNs and 36 medical patients, and you're carrying a tray of meds around that you've poured hundreds of meds and you're handing them out. So, how there weren't more med errors, I don't know, and probably there were more than we know. Certainly it's a different place today. We still make med errors, but we've come a long ways.
Yeah, the system engineering has really helped.
Absolutely.
So much that it's crazy to think now that I work now in a clinical environment where I'm giving meds to pediatric patients, and scan the patient, scan the meds, scan the patient again. It's checks and double checks, and I can't even imagine how many times I was like, go get something from a drawer. Not even a Pyxis drawer, just a drawer, and you go get that and take it and give it to the patient, and you're like, think to yourself, so potential for error.
Absolutely.
So it's kind of crazy. Tell me about a patient who touched your heart, a patient that you'll never forget.
Without thinking of this in advance, I'm probably going to go back to some of my patients I had in otorhinolaryngology, and part of the reason is because we had those patients for so long up in that unit. We certainly had the routine patients up there, the rhinoplasties and the Lafort repairs and all that, but we would get these head and neck cancers. And the hospital I worked at was actually fairly well known for some of the really advanced surgeries you're doing for head and neck at the time. So our patients could be with us for 6 or 9 months. So, they became family. You became their family, especially if you're a primary nurse. You'd have somebody for 6 or 9 months. There's one lady I remember, and I can't even tell you her name anymore. I'm going to say she was elderly, but remember, I was 20 at the time, so a 35-year-old looked elderly back then. But as I recall, she was probably 50 or 60. She had developed a significant cancer of the mouth, and we had to take the bottom of her face off and rebuild it. We did a lot of rebuilding at the time. So she was with us for months, having to be tube fed. I became so close with her family and so close with her because, I worked full time. She was my primary. So every time I worked, she was my patient. And, the packings that were required when we would excavate her face. And I also remember her self-esteem issues, she was I'm sure at one point in her life, a beautiful woman who we had to remove her face. And she couldn't eat anymore. And I think her depression, but for whatever, I'm going to say the 6 months she was with us, we grew a relationship and she learned to talk again. We were able to teach her to talk with her Cooperand, and we were able to rebuild her face to a certain degree. And I think one of the reasons I remember is not just this deep relationship we had, but when I finally discharged her, I remember there was some great sadness on my part because I had grown accustomed to her. But when I went into her room at the end, there was an envelope with a $250 tip with my name on it. And I remember freaking out because, we can't take tips. And I was so afraid someone was going to find out. And I didn't know how to get the money back to them. I ended up keeping the money and nobody found out. But, number one, it touched me how much I had grown accustomed to her. And then, I don't know, just that the family felt that they wanted to leave me extra money. I mean, she stands out in my mind. But the story doesn't end there. Like so many of our patients in otorhinolaryngology, a year later she came back with recurrence and we helped her die. And that was the tough part about working up there is we would do these just incredible surgeries and removing patients' faces and putting their stomachs in their throats and all this crazy stuff, to buy them a year and then they'd come back and die. So I'm going to say maybe she stands out the most in my mind, but she's just one of so many.
Yeah.
There's another one I'll never forget. He was, just a cranky old man. Oh my gosh, I can't even begin to tell you how awful he was. He would abuse the staff, and he had this horrible abscess in his neck. He had a retropharyngeal abscess that had to be drained. And we'd pack him with 6 to 8 feet of packing in his neck.
Okay.
We'd just shove it down there and then pull that putrid brown negative stuff out of his neck. And the smell in his room, and he was cranky, which I think I would be too if I had a hole that big in my neck. I ended up being the only nurse that he would really let take care of him, and I hated it. I hated being his primary nurse because he just was so unpleasant. But I think we developed this codependency. He decided he liked me and maybe was less mean to me than the others. And his family was so apologetic, and I guess being able to break through that tough old barrier. He never ever said nice things to me, but ultimately this cranky old man only wanted me, and so he sticks out of my memory. And as far as I know, he lived. I don't know that he came back to die later on, at least not during my time there.
Yeah. Speaking of patients dying and caring for that piece of them, do you remember the first time you had to have the death talk with a family or with the family members of someone who is dying?
Absolutely. I actually worked my way through high school and college as a CNA in a nursing home. So I first of all remember my first time I watched somebody die in the nursing home. One of our long-term residents who I liked, and I was there that night. I remember just sitting with him and holding his hand, and boy, walking out. And when you work in a nursing home, everybody else is used to death, and I don't think anybody thought about, wow, this is Jeff's first death. And I remember that real empty feeling. Something I've never ever forgotten, even as a staff nurse now. When there's a death on the unit, I really do make sure I look around and assure that there's not somebody like me that's facing it for the first time. So I remember my first experience with death with this gentleman. And then my first time to share with somebody that they died. Again, actually, I would say it was in high school before I was a nurse.
Wow.
When I was a patient. The unfortunate thing is having cancer at 15, you're too old for a pediatric unit, far too young for a cancer unit, and they stuck me on a med-onc ward. So all my roommates were like 80 or above, I swear, and they would die constantly. Wake up in the middle of the night to them running a code on your roommates. So I do remember one night, one of my roommates, when I was 15 years old, coded and passed away. I didn't actually have to see the body, but the next day when the family came in, there was no nurses, so I was the one that had to tell them at 15 years old.
Oh my gosh,
I was still pretty
terrible.
upset myself.
Holy cow, that's terrible.
Yeah.
Wow. That's crazy.
It was crazy. Yeah, it was not a pleasant year being a teenager on a med-onc unit.
I bet.
Don't ever do that to a patient.
I bet. Now it would be such there's probably a very specialty unit, for peds in that situation where, a long time ago there wasn't. It was just, they probably put you where they had the right nurses, and if you just happen to be, 50 years younger than everybody else, and you just happen to be 50 years younger than anyone else, and they probably didn't think twice about it. But I can't even imagine what was going through your head.
Well, it was a little bit young, and it was a little bit young to face death, and then of course, dealing with cancer yourself, that was maybe a little closer to death than you wanted to be at the time when you were facing your own mortality for the first time at 15. Going into nursing, I don't know that I remember my very first time I had to tell a family who lost a loved one, but obviously working in an emergency department, that was part of our everydays. I I think one I remember that stands out. It was definitely not my first, but it would have been an earlier one. Was a family. A young man died in a motor vehicle collision, and so I went and I told the family, and I'll never forget his brother just got angry, and I thought his brother was going to hit me, and he said, "You're a hospital. You can save everybody. Go back in there, save my brother." And I kept saying, "I'm so sorry," and I'll never forget. I don't know how long he just like was angry and lording over me and just kept saying, "You're a hospital. You can save everybody. Go back now, go back now." And yeah,
Yeah.
that one stands out as a difficult one.
Yeah, that's tough. Holy cow! When the family members have that kind of emotional reaction,
Yeah, absolutely.
it's heartbreaking. It's hard. I'm always amazed. I'm always impressed at how well nurses keep it together during situations like that. They don't freak out. They're not, you know, crying and blubbering with the family, or getting angry as well. And it just becomes part of what we do. But it's one of those things that I always think about that, because I've had to have that conversation more now in the role I'm in now than I think I did as a nurse. As a nurse, I was always the one just kind of taking care of the family. Now, as a house supervisor, which is what I do full time, it's, you know, they're looking after the patient, I'm looking after the family, and I'm like, this is a job I always wanted somebody else to do.
And I wouldn't say that nurses don't ever blubber with their families. How many times have we done it?
Absolutely.
We
Have you ever cried in front of a family?
absolutely, many, many times. I have no problem when families are going through difficult times of shedding a tear with them. To me, that's human. I look
Yeah.
back on my own experience with cancer, and some of the nurses that stand out most in my mind in the care for me were those that hurt with me, those
Yeah.
that cried when I cried, and, those that hurt when I hurt, and they meant the most. And that taught me that it's okay. It's okay not only to show emotion, but it means a lot.
Yeah. Is there a particular nurse that you'll never forget?
Absolutely, and I tell her story all the time as a motivational speaker. I was a cancer patient back when there was primary nursing, so I had the same nurse Monday to Friday day shift, and ironically, she took a day off. I don't know if she was sick or vacation, who knows at the time, but a PRN nurse filled in for her, and I still to this day don't know the nurse's name, and I regret that, but I can tell you exactly what she looked like. She had scrubs on, and she was perfect. I don't think a wrinkle would dare land on her scrubs. One of those nurses that just looks perfect. She had blonde hair pulled really tightly back into a bun. And again, I'll say she was an older nurse, but I mean, I was 15, so
Yeah.
anybody looked old back then. But I would say she was an older nurse, and it was a day that I had to have a bone marrow aspiration. And one of the challenges I had being a cancer patient at 15 was doing it alone. My family was not of well means. We lived 3 hours away from the cancer hospital, so my mom and dad had to stay back in the town I lived in to work, to put food on the table, and to take care of the rest of my family. So I was alone. I faced cancer alone up there. And so I had to have this bone marrow aspiration. And I had no family. I had nobody. It was just a
Wow.
15-year-old against the world. And so I remember this nurse coming in that morning. And, oh, before the nurse came in, the resident came in ahead of her, and he said, "You can have a bone marrow aspiration." I said, yeah, I knew about that. And he said, "Now it's going to hurt." And he said, "It'll feel like this." And he took his knuckle and he pushed it really hard into my humerus. I don't know how I wish I could give a resident that same resident a bone marrow aspiration and tell him how wrong he was. But anyway, the nurse came in a little bit later and she said, "You're gonna have a bone marrow aspiration. Would you like someone to sit with you?" And I can remember thinking, I don't need no nurse sitting with me, but I'm a nice guy, so I let her sit with me for her sake, not mine. So a little bit later, the med students came in and they set up for this bone marrow aspiration, and they had me roll over on my side, and then this nurse, this PRN nurse that I didn't really know, took a stool and she sat on the bed on the side that I'd be facing, and the med students and everything were on the other side. The attending gets there, and he preps the area, and then the bone marrow starts. And I'm sure many people who are listening to this know full well what a bone marrow is like, but it is an extraordinarily painful event. Every time they would drill into that bone to take that out, you could feel that grinding of bone as they chipped away at it. And then when they pulled that bone marrow out, that stinging that just is so deep in your soul. There's no way to describe the pain of that. And I just remember that nurse, she didn't say anything to me. She knew I was a teenager. She knew I was trying to be tough. So she just sat there at the bed quietly, and she rested her hands close enough that they were there if I needed them, but she didn't push it. And sure enough, as the pain became unbearable, I just remember reaching out quietly and just grabbing her hand and squeezing it as hard as I could. I think I probably caused a little bit of hypoxia. But she didn't say anything. She didn't make me feel like a scared teenager. She just sat there. She held my hand, and she just quietly was a presence while I was there. And then the awful thing happened. They finished that dumb bone marrow, and the attending said, I'm sorry we couldn't get enough marrow out of this side. I'm going to need your consent for the other.
Oh,
And I
gosh.
just remember screaming to myself, like, no, I'm not going to let nobody do that to me again. And that nurse, she just was really quiet, and she made sure no one else could hear. She bent down really close to me, and she says, together we can do this. And she moved her stool to the other side, and they rolled me over, and I consented. And this time I wasn't scared to grab her hand. I held her hand, and I squeezed it as they did it. And I'll never forget that woman. That woman was a big part of why I became a nurse. Not because she did anything great. She sat at my bedside for 10 minutes during a bone marrow and was a quiet presence, but she will always, always, always be a hero in my world. And if there's anything I'd love today is to find her and tell her, but I can't. So instead, I just tell her story to hundreds of thousands of people every year. She's a hero
That's
in
cool.
my books.
That's awesome. That's a great story.
And what I love about it is that's what we do every day as nurses. And most of the time, we don't know it. She
You have
has
no idea.
no idea.
No idea.
She has no idea that she
It's
made a
just
difference
every
in
other
this young
day.
man's life.
It's just every other day to her.
So how many times have I or any nurse hugged somebody, held their hand, said the right word, made a phone call that to us was just another minute in our day that impacted that person's life forever? And that's a gift we're given as nurses
Every day.
every day.
Every day. But I think that's one of the coolest things about being a nurse is you have such small things we do like have a really big impact. And it's just, just a nicety, a kindness. And, it really makes a big impact to patients and they'll never forget it.
Absolutely.
So I think that's one of the most powerful things about being a nurse. It's just something I really enjoy. What's the best advice your mom ever gave you that you then applied to nursing?
My family, including my mom, and she was a big part of it, was not afraid to show emotion. We were a very emotional family, and we were encouraged to wear our heart on our sleeve, to be emotional. And so, as I talk about, the question asked earlier, do you cry with patients? Have you? And I do. And I do that because my mom gave me permission to do that. My mom gave me permission to be a human being and to care. And that's part of who I am as a nurse. I'm not your nurse. I'm a fellow human being that just happens to take care of you. And my mom gave me permission to do that.
That's cool.
Yeah.
That's cool. What did your mom do? You said she wasn't a. What did she do?
My mom was, I'm going to say my mom was a mom, a home keeper.
Yeah.
She did a lot of odd jobs outside the home. As I said, I was not raised in a family that had a lot. We struggled to make ends meet, so my mom often did odd jobs, whether it was cooking or a receptionist or whatever. But, if you ask my mom what she was a mother and a homemaker.
Nice.
First, and then she did odd jobs to make sure food was on the table.
That's awesome. What's the best advice a nurse mentor ever gave you?
The best advice a nurse mentor ever gave me, to pursue every dream that you have, whether you feel qualified or not. I early on in my career, my preceptor just kept saying, well, if that's what you want, do it. Don't be afraid of it. And, I don't have the education. Don't be afraid. Just go for it. Just go for it. And, that became my mantra. You look at my career, it's been it's a fairy tale career. There's no doubt, I've got to do things that most people only dream of. And you know what, most people look back at my career, I started as a diploma nurse, and I'm not advocating for this, but that's just what I started as a diploma nurse and didn't finish my bachelor's degree until I would have been a nurse almost 18 years.
Wow.
By the time I got my bachelor's degree, I had already been the chief nursing officer of a 500-bed hospital. I had been a director of the 14th largest emergency department in the United States with my associate's degree, kind of unheard of. And why is that? Because I wasn't afraid to take the leap. When the opportunities arose, I followed my preceptor's advice and I went for it. And no, I didn't always get picked. And I probably should have gone back and got my education a little sooner in my career. I didn't, But I was given all these opportunities and this fairy tale career because I'm not afraid to try. You know what? And if somebody says no, that's fine. I'll just take the next opportunity. So that's the best advice I was given.
That's cool. I like that. What advice would you give a brand new emergency nurse?
Um, I'm going to answer that in a couple ways. A lot of times, I'm going to talk first of all. New grad nurses will often ask me, should I go into the emergency department right away or not? And it's a difficult question, but I have an answer, and I'll start with that one. Um, I only recommend that new graduate nurses go into the emergency department if they know in the heart of hearts that they want to be an emergency nurse the rest of their lives. If you do, there's probably no place that'll make you happy aside from that, so you might as well go to the place that makes you happy. However, I do believe that starting in a critical care area as a new graduate nurse can be a little bit of a career limiting move, and it's not a wise move. And much of the reason why I've had such great upward mobility in my career is I started off, doing intensive care and, in an area that then allowed me to really solidify the skills I learned in school. I went to the emergency department a little bit later in my career, but because I had that wide base of skills in the beginning, I could do that upward mobility quicker out of the emergency department. Whereas if you start in the emergency department, you get stuck. It's hard to get out, and it really limits your career. So the first advice I'd give to a new graduate nurse coming out is really examine what your ultimate goal is. And if you want to be an emergency nurse when you're 60, then go into emergency department. I'll right off and be happy. But if you know that that's not your ultimate goal, then going into a critical care area right out of school could be a very career limiting or career slowing move. Now going to what would I give advice to an emergency nurse early on? Forget new graduate. Um, I believe deeply in career paths and career goals. I have always been a very goal-driven person, and I knew from before I went into nursing school what I wanted to do with my life, and I had a goal, and I set that goal, and I pursued it, and I had mentors, and I would check with them. Is this career move? Is this going to move towards that final goal? And because I was very goal driven, I reached my goal at 24. I graduated at 19. I at 24, I had reached my first career goal, and I set my next one. I expected that. I expected to make that career goal by the time I retired, not at 24.
Yeah.
I set my next career goal. I made that at 31. And I kept setting these goals, but because I was very goal driven and knew where I was going to go, then it allowed me to constantly move my career there and be successful. I am surprised how many nurses really don't have a career goal. You ask them what they're going to do, and I don't know. I'm trying to figure it out. Maybe this. How many people apply for my mentorship program at my company, and you ask them, so if you get this mentorship, what is it you want to do? I don't know. I'm looking. You know what? It's like a ship without a rudder. If you don't know where you're going, you're just going to aimlessly go through the water and never end up at a destination. So my advice for nurses, whether you're new to the emergency room or anywhere, set a career goal early. Know what you want, what's success, where do you want to be at 55, and then have mentors that'll help guide you there, that'll tell you whether your career moves are good or bad. And that's really the only way you're going to feel, I think, successful in a career.
Yeah. What's your next goal? I mean, you look at what you've done. You've done so much in your career. You're, educator, been all over the world, philanthropist. You're starting movements everywhere, left and right. What's next?
That's not a good question to ask me, Kevin. You know what? It's interesting. I'm done. That's why I said it's not a good question to ask. I'm not sure I want to say that publicly, but it is what it is. I do. I believe in the last couple of years I accomplished some pretty big goals in my life.
Huge.
So when it comes to nursing, I don't know that I have another goal. And then so,
Okay.
now I'm the one aimlessly wondering, but I'm beginning to look at life beyond nursing now to say, in nursing, I think I've accomplished what it is I wanted to do. I still enjoy what I do, but I don't know that maybe I've reached a place in my life where I'm satisfied with where I've been, and
Fair answer.
yeah, I don't know. I don't know that there's another big goal. In some ways, I'm tired, and I'm ready to let the younger generation take the torch from me and continue the legacy that I built.
I like that. That's good.
But I probably couldn't have said that until about 2 years ago. it's about 2 years ago that I'm again like, yeah, okay, I'm done.
You're like, what's those last couple things on
Check them
on
off.
that checkbox, and get those done, and then be like, all right, people,
Yep.
it's yours from here.
Check them off.
Yeah, we
Yep.
got it from here.
That's
So
right. That's right.
that's cool. I like that. One of the last questions I ask everybody is I ask a question called 3 things. And I ask for 3 things an emergency nurse should always remember, and 3 things an emergency nurse can just go ahead and forget.
So 3 things an emergency nurse should never, let's start with never forget or always remember. Number 1, know who your patients are and where they come from. I think too many times in the emergency department, we move our patients through very quickly, and we fail to recognize who the person is under the illness, who the person is beyond the gown. And I can think about that for almost anybody, but I always think about that for our homeless population, and for to a lesser degree, I suppose our mental health patients. But I'll just use homelessness, and it's not a secret. I have a heart for homelessness. I enjoy going out and sleeping on the streets. It's something I do at least once a month. And the reason I enjoy going and sleeping on the streets is because I love hearing the story of the homeless and how they got there and who that person is. Under that dirty exterior and that person begging for money on the corner is a rich person, a person who many times came from a very, very similar background to where I was and even where I am today. And a health problem or a divorce or something just turned their life in a different direction and they end up on the streets. And their stories are so rich. And I look at the emergency department, I often see emergency nurses can get over time jaded. It happens, it's who we are. We deal with a tough population, and we see a homeless person only as a homeless person. And underneath that exterior is a person in pain, is a person with a rich history, is a human being that gets overlooked. So as an emergency nurse, always know who you're caring for. When you have that homeless person, when you have that dirty person, ask them, who are you? What do you do for a living? And we know they're homeless and they may not do anything, but they'll tell you about their past because that's what they hold on to. And somewhere in there, find the dignity of that human. And every person, make sure you know who you're caring for beyond the gown and beyond who they are. The second thing I think as emergency nurses that I would hope that we all remember is that every patient's having their own emergency in the emergency department. It probably doesn't stack up to the worst of what we see, but for them, it's an emergency.
Absolutely.
And I think sometimes when we minimize or belittle somebody's illness because it doesn't stack up to our definition of emergency, because we see the worst of the worst, we take away that person's moment. Coming to the emergency department is stressful, it's expensive, it's denting their day and probably creating them exceptional stress.
Yeah.
And when we minimize it, we ruin that experience. So I would ask every emergency nurse to remember that every patient who comes to the emergency department is having their own little emergency, or their own big emergency, I guess, for that matter. The other thing I would ask all emergency nurses to remember is to take care of themselves. You don't have to pick up every overtime shift, nor do you have to stay overtime because you're part of the team. You're on your own team, and so always take care of yourself. Get rest, say no, take breaks. Don't be a martyr, don't be a nurse. Be a human. So I think those would be the 3 things I'd, off the top of my head, ask emergency nurses to remember. What are the 3 things we should forget? We should forget half of what we're taught in nursing school because it's just not right and it doesn't matter. So just forget all the things that don't apply to real life.
I get that answer so often.
Is that right?
So often I get that
so
answer.
unique.
So often I get that answer where people are like, forget what you learned in nursing school, start fresh. So that's a fairly common answer, but it's true. It resonates.
Yeah, absolutely.
So.
Yeah. What other 2 things should emergency nurses forget? Oh boy, that's a tough question.
It's a tough question.
It's a really tough question. We should um, we should forget those patients that hurt us. Patients will hurt you. They will say things that, and when I say hurt, I'm talking about emotional hurt. They will say things that hurt. They will strike out at us. Um, they will make you feel like you're less of a person, and that's what makes us tough, and that's what makes us non-caring. So forget it, and just remember that number one, not all people are kind, and those people are part of our world, and we have to put up with them. But I would also remind us that so many of our patients are under such undue stress, and they react in ways they wouldn't otherwise, and the things they say are usually not meant for us. So forget them. Just forget them, and only remember the good things, because the bad things are part of nursing, and I hate it, and I wish it would go away, but it won't. So we just have to forget those patients that say bad things and those experiences that leave bad tastes in our mouth. And the other thing to forget, forget the stupid rule that you can't drink at the nursing station. You can eat and drink all you want at the nursing station. It's night shift. Who cares? The CDC said it isn't bad anymore, so who cares?
I think that's a change that's time has come.
There we go. An easy answer.
Had that conversation just last night with the medical director for the department I work for and one of the doctors, and had a long drawn out discussion about just that. And I was like, we're having this discussion because you're hungry, aren't we? And she's like, yes, Kevin, I'm hungry. And I was like, I understand. What's your scariest moment you remember in the emergency department?
Of course, I probably, like most people, it would be during a psychiatric patient who was acting out. And actually, here we go with another death story. So, I had to take it back. It wasn't even a psychiatric patient. It just happened in the psychiatric room. We happened to take the family to a psychiatric room to inform them that their loved one had passed away. So they weren't psych; they were just a family. But one of the young men, in his anger and sorrow, grabbed a chair and whipped it at my head. Now, fortunately, it missed me, but it put a hole in the wall behind me. I'll never forget that moment. And it doesn't matter how many times you say, make sure that there's a good egress from the room or whatever. You don't always follow it. And I didn't have egress from the room. Now, fortunately, once the chair was whipped at my head, it didn't hit me, and he settled down. And that was probably one of my scarier moments. Another one I just thought of too, but it wasn't as a nurse. It was as an ER director. But I had to fire one of my employees who was huge. I mean, the guy could eat me for lunch and not even pick his teeth afterwards. And I had to fire him. And so I went in. My office was this narrow little thing, and I did the wrong thing. I went in first, and he came in after me. No egress. And so when I told him he was fired, ultimately, I just remember him picking the phone up off the desk to whip it at my head. And I thought, I can't get out of here. I'm going to die in this room. But he didn't whip the phone at my head, and I didn't have to egress the room. But yeah, so those are some ER nurse experiences I'll never forget.
I bet. I bet. What's something about you that most people don't know that they should know?
And what many people don't know about me and will probably be surprised is how introverted I am. I am like the world's biggest introvert.
Stop,
I know.
you're lying.
I know. People don't realize that. And that's good. And so last year, as I was forced into this presidency, and really, when I say forced, I'm talking about the better word is I was forced to be in the public eye is what I meant.
Absolutely.
Through the presidency.
Absolutely.
Oh, so uncomfortable. And,
really?
Very, very uncomfortable.
I'm completely stunned.
And it was funny at the end of the year, as I narrowed down, and especially the ENA staff, we kind of begin to talk a lot about the year. And I said, I'm really going to be glad to be done, because this has just been so uncomfortable for me this year to be this far into the public eye and not have a lot of private time. And a lot of people, a lot of the staff were like, "You're not introverted," and I'm like, "I am." you give me a choice between being out with people or being at home in my garden, I will always be home by myself. And I really have to push myself to go out and be with people and do things. I'm like a pretty big introvert, actually.
What
So that's what most people won't know about me.
that I'm stunned.
Yes.
And I could see that. I get it. I understand that, just because you're an introvert doesn't mean you can't do those things.
Right.
It just may not be what you prefer to do.
It's not my comfort
But
zone.
but I would never have guessed that wasn't your comfort zone. I mean, you seem so at ease on stage, so at ease with a crowd. I mean, people at the ENA conference treat you like you're a rock star, and and you seem very at ease at that. With
Right.
that.
And it's just not where I want to be. I will do it, and I understand it's part of my role. I'm a public figure, and somehow I've grown into this role, and I do it, and I put my whole heart into it. But if it would be where I would choose, no, I would not choose to be a public figure. I'm much
Interesting.
happier as a private person.
Interesting.
Yeah, so there you
Okay.
go. Took me a minute to think of something.
That's something that I think most people won't know.
Yeah, that would be much more than anything else I could have said. So, what did I enjoy most about the presidency last year? The interesting thing, and now that I tell you I'm an introvert, I I really, really enjoyed representing. I think the figurehead part of the job was the thing I enjoyed the most. I loved representing emergency nursing.
What an honor to be able to do.
Absolutely. I mean, what is it, 40 some people before me, I think, 46 or whatever people before me have had this opportunity to actually represent our profession. I mean, what a great honor. And, whether I was, going through Arizona in the Indian reservation, meeting, all those people, in Las Vegas, meeting the incredible heroes that were involved with the shooting, in Florida, going down there and meeting with those, being at our ENA conferences and meeting with emergency nurses. And you're right, I understand that, I have a bit of a public persona without being the president, and then add the presidency to it. People look to me to be a representative for nursing, and I was so proud to do that and so energized. That's a part I loved, is just giving people somebody, to be a representative, and hopefully setting a good example for what emergency nursing should be in philanthropy and in compassion. And I hope I set that example, and I hope people look up to me and will follow it. And if I've made a difference and people try to be an emergency nurse with more philanthropy and more compassion because of what they saw in me, I would consider it a very successful presidency, and it's the thing I really enjoyed doing.
That's cool. What was the biggest challenge, or what was the thing that was unexpectedly hard being the president?
Boy, it's not a good time to ask me that, because I'm still a bit reeling from everything that happened. I don't think people realize the incredible personal sacrifice that we make as a president.
Can't even imagine.
And I knew it was there all along, but I don't think I realized the depth of the sacrifice till I went through it. And I want to make sure I make clear as I talk here that I'm not, that many of the choices I made to be the president were choices I made. They weren't required, but I gave up my businesses. I gave up my passions. I made sure my calendar was free for a year. Here I am 6 months post-presidency with, they're not there anymore. I've lost everything I spent my life building for. And, trying to rebuild your life at my age it's not easy. And there's times you look back and say, should I have done this? Like, should I have given up everything for this? I don't know. So yeah, there's the personal sacrifice, the time away from my family. I lost a relationship that meant the world to me. I lost my third world organization. I lost my businesses. And I made those choices. So I can't blame anybody, but it's an incredible personal sacrifice that's made.
I can't even imagine.
And so that would be my regret, is the personal sacrifice that was made, and how it lasts well past the presidency. But I don't want this to be negative. I mean, if I look back on the year, the things I gained, the experiences I got, all that stuff cannot be replaced. And so it's not like I'm a martyr, and I say, oh, poor Jeff, he's got this horrible life because he was a president. No, I'm very much enriched and proud of what I did, but it was not without sacrifice, and I'm not alone. Every president before me pays an incredible personal sacrifice to do that.
I remember the first national committee I was on, one of the people I was on the committee with was Benny Merritt.
Uh-huh.
And Benny Merritt at that time was like, well, what do you think? Are you thinking kind of maybe working your way towards the board? And at that time I was, and that was one of the things that was on my goals. Still not sure it's not, but was one of the things on my goals. And he's like, understand. He goes, the board's a lot of responsibility and it's a lot of sacrifice. He's like, if you decide you want to run for president, he's like, it's a whole different story. And we were talking about the person who was the president at the time, and he goes, this person's made quite the sacrifice to do this, and that's what everyone before has done. And he said, sometimes it's at greater personal peril than others, but it's like everybody sacrifices if they take that role.
Absolutely.
Because at the time, I was thinking to myself, I could see myself running for board, and then maybe at some point running for president. And he's like, "Be ready. It's not easy, friend." And I was like, I took heed in that and realized that it was something that made me kind of take pause and say, okay, maybe this isn't something I'm not quite ready to do in the place I am in my life at the time.
Yeah.
So it sounds like that was pretty good advice.
Yeah, absolutely.
So. That's cool. What's next?
Well, I'm actually working on my biography through a ghostwriter and thoroughly enjoying that. It's a chance to go back and revisit your life, bringing back the key players in my life to do the interviews as we put together the book. I'm enjoying it. You know what? Even if the book were never to come out, hope it does for all the work we're putting into it, I'd be happy because I'm getting a chance to relive my life in ways that nobody else does. So I'm working on my biography right now. I have several other books that I have on the back shelf. I'm waiting for the biography to be done, but I'm going to write a couple other books when I'm finished. I still do some speaking, cut back on that dramatically, but still doing some speaking. I still realize that I do have a responsibility to our profession. I was given a role, and so I still do a lot of that. I love to go visit our nurses that have gone through hardships, through natural or man-made disasters. So I still, see some of the figurehead position that's left behind, and I hope to continue to do that. My love or my passion, I think is a better word for homelessness, still burns deep in my soul. I still go out and sleep on the streets once a month, but I can see that as my time frees up, I'll probably be doing a lot more of that. I've been looking really deeply at possibly trying to get a grant to open a homeless shelter, a rehabilitation center for homeless. I don't know for sure if that's in my future, but my passion for homeless is so deep. That may be part of my future. Exactly where that goes, I don't know. As we talked about earlier in the interview, I still have maybe half an eye on politics. I think that's slowly going away, but
Yeah.
I haven't completely closed the door on that.
Boy, talk about another personal sacrifice. Holy cow.
Mm-hmm.
And then
that's the reason I'm really questioning it now.
And then having everything you did, everything you said, done, examined under a microscope and put out for public viewing.
Absolutely.
Like all your skeletons in your closet come out to say hello.
And 10 years ago, I probably would have been there, but I really have to, after the experience last year, I don't know that I'm ready to put myself out there as an introvert for another run for politics. However,
Another run for politics?
Mm-hmm, I have run for politics in the past, yeah.
Have you?
Unsuccessfully, but I ran. And I think, it is. It's a personal sacrifice for an introvert. It's an uncomfortable place to be. We've already talked about that. So, I'm a little too young to retire, but maybe getting a little bit too old to start something new. So I'm kind of trying to figure out exactly what it means.
I was going to remind you that you're a little young to retire. I was going to remind you of that.
A little young to retire, but I think I'm a little old to start too many new things. So one of the jokes I always make is I think I ran for the presidency at the wrong age. I ran, so you have to end your life. So your presidency kind of brings your whole life to an end for a year. Then you have to restart it. Well, it would be easier if I were either younger or near the end of my life. But I'm kind of in a weird place where I still have to work, but I don't know that I have the energy to start all over again.
understand.
Yeah. So there's my advice to anybody wanting to run for president. Either do it when you're really young or wait till the end of your life. Or your end of your career anyway.
Gotcha. That's probably pretty good advice.
Yeah.
So I think that's all the questions I have for you. This has been a lot of fun.
Yeah, it has been. Yeah.
I want to take an opportunity to just publicly thank you. You've been a bit of a mentor for me and have let me kind of follow around on your coattails and ask you questions and help guide me. So I just want to say thank you for that and let you know how much that means to me and how much I appreciate you for that and for always being willing to give me advice and point me in the right direction and kind of mentor me as much as you could. And I just want to say thank you for that. I really appreciate that.
Well, kind words. I deeply appreciate it. Yeah, I don't know how to say thank you except to use those simple words, thank you. But yeah, I think that's really what life's about, and especially what nursing's about, is just sharing, isn't it?
Absolutely.
And helping others to be successful. So, I think my personality was one of these people that my success was a lot done on my own. I'm not good about turning to others for help. But I decided early on as my career unfolded that one of my goals was always to make sure no one else had to claw from the bottom up without knowing what to do. And I love to share with others.
Thanks for listening to the Art of Emergency Nursing podcast. Make sure to subscribe to the podcast and follow us on Facebook.
I don't want to like it, so
Try to all the time.
that's what it's about.
Anyways, I appreciate you taking the time to sit down with me and go over these questions, and thank you so much.
Thank you, Kevin.
So.